I'm Dr. Warren, and today I want to run through an article from Johns Hopkins that highlights how many people, maybe you're one of them, that are kind of slipping through the cracks of the medical system and developing chronic Lyme or post-treatment Lyme. One of the questions I frequently get is, why couldn't they find me? Or why can't they find this? Or why is my doctor so baffled by this when it seems like it's so easy to just start Googling and find all this information on it? And I think we've had, institutions like Johns Hopkins and Columbia particularly, who have really been trying to carry the banner and just provide research that's going to help wake up the rest of the medical community towards realizing how big of a problem chronic Lyme is and how much it's happening. So what we did in this study is they found people who had acute Lyme that we found it right away, and we got the standard antibiotic course. And then they saw how many of those people over the next 12 months developed chronic symptoms or still had chronic symptoms even after they'd been, treated with the, appropriate CDC recommended treatment. We've said for years that this is about a 99% successful protocol and that we think the antibiotics work very well, and that the thing has been on trying to get proper diagnosis early, which is still important, but they highlighted here that it doesn't work as well as we once thought it did. So what they say in the summary? Results found that functionally impairing persistent symptoms occurred in 14% of the early treated Lyme disease patients. Now, it's about a 4% control group buzz. So you could subtract that out and say about 10% difference between the two groups. But what they're saying here is that even people who found the bug right away and got on antibiotics, still 10% of them had long-term symptoms. What were the long-term symptoms? Severe fatigue, body pain, and cognitive challenges. Now, this brings up for me, where do people go if they have those kinds of persistent symptoms? We get people who get in pain clinics. They get sent to neurology for the cognitive symptoms or the pain, and they get sent to rheumatology. This is extremely frequent, is that people who are falling through the cracks of the system start to get referrals to other specialists. And I would argue also dermatology. When we get weird rashes, people are going to dermatologists. And I think all doctors, but neurologists and rheumatologists especially, need to be extremely aware that they're getting patients sent to them who really have Lyme disease that either has been totally missed and no one's found it, or they treated it and the treatment didn't work. They got the protocol and they're part of this 10% or 14% group who didn't get better with it. And I do not see neurologists and rheumatologists really stepping up to the plate and recognizing that that's really the problem. Now, what I want to highlight here is just some stats in this study to keep it simple, but they had 234 patients in the study, and they did some statistical analysis with a control group. This is, good science to say that this is a problem. I also, want to highlight that they said results were highly statistically significant, and they indicate symptoms were not just mild fatigue and the pain of everyday living, but rather they were severe fatigue and pain that impacted quality of life. And this is what we're battling on a regular basis is, ticks and Lyme, when it goes chronic, is not the same life-threatening illness in the acute phase, but it causes severe enough symptoms with the fatigue, the pain, and then the neurological problems that it's affecting your life. It's affecting your marriage. It's affecting your work. And this is what health is not, is when you don't have the health to do the things in life that you want to do. And so if we're having, fatigue, pain, or neurological problems that are impacting our life, man, Lyme disease is really on the table for being a probable cause. Certainly not the only cause, but a huge cause that we right now know is slipping through the cracks at least 10% of the time on people who were even properly treated. Now, they speculate above right here that people who aren't properly treated, this group right here is properly treated people. It's a 10%, 14% miss rate. They speculate that I think it's 20 to 30% of people in complicated patients, such as those with delayed diagnosis. So if we don't find it for a year or two, persistent symptoms may be closer to 20, 30%. Now that's complete speculation. And this is what's really hard in studies, could you get a group of 234 people who you didn't find the Lyme for over a year and see your success rate? I think the persistent symptoms in people who have this over a year before they're diagnosed would be much higher than their 20 to 30% estimation. But I've never seen a study. That's a harder group of people to find and to study. But I think it'd be very valid because so many of my patients haven't been properly diagnosed. They didn't find it in the first 3 months. They took them years sometimes to find it. So I think this is a good article. It highlights that the current treatments for Lyme are not quite adequate. I want to just end by saying what they recommend here, which is just the approach that we really recommend, because the standard approach is this: you just do an antibiotic and that's it. And Johns Hopkins has been highlighting this for years, and I think it's the correct approach. More research is needed to determine if there are common mechanisms of inflammation and immune response dysregulation, autonomic nervous system dysfunction, or pathogenic or antigen persistence. So let's highlight those three things. So in order to best go after Lyme, they want more research in your immune system, both inflammation and immune system function, because your immune system is supposed to kill this bug. So we want to be able to help your immune system in that fight. 2, they talk about nervous system dysregulation. I will extend that to any system of the body. You want to repair the part of your body that Lyme disease has hurt. Now, that is frequently the nervous system, but that also could be, it can hurt joints, it can hurt muscles, it can hurt mitochondria, it can hurt the heart, it can hurt the liver. And so whichever part of your body that has been damaged by Lyme needs to be repaired. And then lastly, they talk about antigen persistence. Now, we would say Lyme and co-infections. We have other articles where we talk about that. But it's not just about killing the log phase of Lyme, and we can go into this in other articles, but once Lyme has been in, or Lyme has been unsuccessfully treated, we find it in all these different forms. We find it in cyst forms and stationary forms and spirochetal forms and log forms. And so there's all these different forms. And what we find is some of these other forms are much more antibiotic resistant and respond better to other substances and can actually cause more severe symptoms than just the simple one. And so the idea that it's just a simple, doxycycline works for everybody and it's all over, this article kind of goes, well, even in the best of circumstances, it works 90% of the time. And we'll go through other articles where we really go at, well, what do you do once it's chronic? But this article, really, even there, they're slipping in order to best do chronic, you need to be doing immune system stuff. You need to be doing rehabbing the body stuff, in this case, the nervous system in this article. And you need to be doing something about persistent forms, or all these forms that the bugs go to when they're in your body chronically. And I hope you found this article helpful, just in realizing that this is a huge problem that's slipping through medicine, and you at least have somebody like Johns Hopkins trying to do peer-reviewed studies to highlight how big of a problem this is, hoping that we get more and more people on board doing research. I'm Dr. Warren. Hope you found this helpful.